Good morning, everybody.
Good morning, Helen.
Okay, I'm going to mute myself again.
Okay.
Good morning.
Hi, how are you? Okay, is everyone on? Courtney? Courtney there?
Yep, everybody's here.
Okay, so it's
Is Maria here? Excuse me, Mr. Chair, is Maria here?
She will be joining, Helen. We need to be a little patient. She's on her way. If you want to wait for her, we can, but I think it's probably just better for everybody's time's sake that we get started.
okay. I'll call the meeting to order. So Tuesday, August 4th, 2020, the time is 10:02 a.m. and I call this meeting of the Select Board and the Emergency Management Task Force to order. First on our agenda is announcements, open session, and public comments. The public comments must be brief. The board will not deliberate or vote on any matter raised solely during announcements and public comments. Do I have any comments from the board or the audience?
Chief Hurley has a comment.
Chief Hurley?
Good morning. Thank you, Mr. Chair. I just want to remind the community, we do have a weather event that's coming up this afternoon and this evening. The emergency management team is monitoring the events. Since last Friday, we have been on daily phone calls with the Barnstable County Emergency Planning Committee, and actually Lieutenant LaRocco is on that right now. If you do have power outages, please call Eversource direct. If you have lines or trees down, please notify us directly so we can respond. Please understand, Eversource does not give us any indication when power restoration will happen to individual neighborhoods. They've also advised us that their COVID-19 response will be a little slower than usual because their crews are smaller and they are trying to follow new guidelines and protocols. So they have pre-positioned crews and tree crews in the area. So we are monitoring it, and any other updates. As of this point, I am not seeing any regional shelters that will for this event. So thank you, Mr. Chair.
Okay, anyone else?
There's a Dennis Quealy.
Denise Quealy.
Denise Quealy, yep.
Hi, good morning, everybody. I don't know if I'm going to have an opportunity to ask the question later, so I thought I'd throw it out there now. And it doesn't have to be addressed now. It can be addressed as, you know, the agenda goes on. But I just noticed driving around on Saturday that there were quite a few out of state plates, which there normally is. But Florida, Georgia, North Carolina, Michigan, so on and so forth. So my question has to do with, I know the governor has a travel advisory or order in place, and I know that this is very hard to enforce from a local perspective. But I didn't know if there was anything like, for instance, the beach office was going to do. So if somebody applies for a beach sticker and they have an out-of-state registration, whether they would not be permitted to get one, or what the story was in terms of how we can address this locally, or if there's any rental units. I know there was at one point there was talk of doing a registry. If there's any sort of direction to the rental units that they know about the advisory. I guess that's my question.
Okay, do we have any more questions from the audience? I can't have anyone answer that directly right now until we start with the next update.
I'm not seeing any more hands raised.
Okay, so we're on to COVID-19 updates and discussions. So I was hoping Chief Hurley could give us a report and maybe speak to the travel advisory to inform everyone what that is.
Thank you, Mr. Chair. Yeah, beginning on August 1st, if you go to mass.gov, there are some new travel restrictions that the governor has put in place for our region. If you are coming from low-risk areas, which those states are listed, most of which are from the Northeast area, there's minimal impact. However, I think 40 or 42 other states, they are asking inbound travelers to either come with a negative COVID test and register online with the state and quarantine for 14 days as necessary. I know around the Cape listening that some short-term rentals and hotels have been reaching out to these out-of-state travelers to advise them of these new guidelines. And there's been quite a few cancellations as a result of it. I know family members have stopped family from coming from those states that are now deemed high risk. So how we manage that, how the state's going to manage it, it's the million-dollar question. A lot of this is self-reporting, obviously, and doing the right thing. So we will continue to push that information out. We had the same issue back this spring with a lot of New York, New Jersey plates in the area when they were a high-risk area at the time. So we just ask for everybody's cooperation. Again, please social distance, wear masks when social distance is not available at the beaches, the parking lots, downtown, the marina. This is a group effort. This is a community effort, and we hope that our visitors will also help in this endeavor to keep the community safe at this point.
Okay, Chief. I'd also just like to remind the public that just because someone has out-of-state plates does not mean that they have been residing out of state for an extended period of time. Please don't take matters into your own hands. There's a lot of people who have plates from Florida who summer up here that may have been there for a long time. So, I just advise people not to make assumptions.
If I could, Mr. Chair, just real quick too, and I know we're getting into August. I know patients are running thin. One thing I would ask, if possible, in the community, Facebook is becoming, or social media, but via Facebook is becoming quite an issue. We're chasing our tails with complaints, comments, observations, and coming to find out 9 out of 10 times, these calls are never reported. Nobody is calling police or fire. Nobody's calling recreation or beaches. They're spending the energy to go online and report these items. They're even Facebook messaging us all hours of the day. We do not monitor that 24/7. I do ask, that's why we're here. You're not bothering us, please call. If you see something happening, if you see a concern, and again, like the chair said, we just keep seeing an uptick of people trying to enforce this themselves. And, please, that's our job. Call us or the respective businesses that you may be in. But we're all under a great deal of stress and anxiety, and these social media posts are not helping anyone's cause, especially the community. So, again, all I ask is please If you drive by the basketball courts and you see something, stop in and report it to them. If you see things on the beaches, please give us a call. It's hard to respond to complaints hours or days later. And again, then it causes quite a bit of anxiety within the community, because then there's a lot of commenting and assumptions and anger on there. So that's all I ask. You know, I know it's frustrating. I know we're getting into August, but again, if you see something, you have a concern about something, please, instead of going to that venue, reach out to any of the department staff members here in town, and we will address it.
Justina?
Yeah, Courtney, am I unmuted?
Yes.
I think this would also be a great opportunity to hear from leadership from our business community. I know the Chamber of Commerce sent out a helpful advisory to short-term rental owners. And I know we had heard a lot from the short-term rental community when we sought to restrict short-term rentals. So given that the travel advisory does affect that business segment, I'd love to hear from the Chamber of Commerce and maybe some players in the space, such as Luke Chapman, about what they're doing in response to the governor's orders and what they're doing to keep our community safe. So perhaps I'd be happy to do some outreach, or maybe we'd hear from them at our next meeting.
Anyone else for the police department? I will say, as far as enforcement of the 14-day, if it sounds like it could be possible to do something with beach stickers. I'd have to hear from the beach department that, you know, they would have to maybe, you know, show the same sort of documentation that they would have to show to prove compliance with the governor's mandate for the quarantine or test results. Seems like something that maybe not be a bad way to go. But we'd have to hear from Suzanne. I don't know if she's on the call before we could make anything like that happen.
Mr. Chair, it's Suzanne.
Hi, Suzanne.
Hi. It's totally possible to require documentation using our beach sticker software. I would have to find out what was the documentation that people can submit, and then make it a mandatory thing if they're coming from a high risk state. I will say that many people come here in rental cars, and the vast majority are New York plates and Florida plates. So we probably would also need to verify their place of origin.
Mm-hmm. So like do they have to show an ID normally?
They don't, except for a shellfish permit. So it's easy to add that to beach stickers.
Right. Okay. Helen, do you have a comment?
Yes, this is for Chief Hurley. So I go to Newcomb Hollow at the end of the day typically, and it's usually fine. But as we all know, I couldn't use my mobile phone from Newcomb Hollow, not even to make a call from the parking lot. And the other day I saw something that I didn't want to get in the middle of, but it was definitely not safe. And there were a number of people involved. And that would have been something I would have thought about it and then made a call, just as you suggest, Chief Hurley. Would it have been appropriate for me to use the emergency phone? Because that's, what is that line like to use? You know, the one that's there for shark attacks and stuff.
Well, I know the fire
How
chief.
should I have reached you? Sorry, how should I have reached the police department?
Well, again, if you consider it something that could potentially or is not a good thing that is happening, please use those phones that are up there. You know, again, we don't want them being used for day-to-day business, but if you know, if you're seeing an incident or an altercation or a group that may, you know, starting to get a little ugly, then please pick up those phones and call us immediately. Those phones go right to County 911, and we will dispatch people up there.
My point is, this was not a 911 situation. This was simply a group of close to about you know, maybe 9, 10 people. You know, it was a bunch of people. They were moving around. They didn't have masks. They were shouting. They were having a good time. It wasn't an emergency. So I would never have called 911. You see what I mean?
Yeah.
I would have called the police department and reported it. I didn't know what to do. That's the point.
Well, we
And
do have
it's-
some challenges up on the ocean side, obviously, with cell
Yeah.
reception and those beaches there.
So
Okay,
just-
so I shouldn't use the emergency phone. Is that correct?
Well,
It's all.
I really
just
don't want to
wanted to-
sit here and tell people what to call and not call on. If you feel necessary that it involves a first responder response, then please use the phone. I'd rather err on the side of caution than start making a list of what calls can be made.
Thank you.
If it is something that you feel like you need to call the business line, but it's important enough that you do so, I mean, it's not that far of a drive to get reception, but an inconvenience to leave the beach, I'm sure. But I just wanted to throw that out there. Okay, so I guess Chief Polly, is he on the line?
Yes, sir, I am.
Do you have any report?
Not at this point. I'm all set, thank you.
Okay, thank you, Chief. Okay, so I guess we'll go on to Outer Cape Health. Lisa Kane. I was just hoping that maybe you could talk about what's going on with testing at Outer Cape Health, the accuracy of the testing, and maybe some advice for people who have been in contact potentially with somebody who's positive, but test negative. You know, maybe some information about sort of how what people should expect a negative test means and what you guys are doing to inform the public who's getting tested. So if you're there, Lisa.
Yes, I am. Thank you, Mr. Chairman. Good morning, everyone. I also asked Dr. Jorgensen to join in on this call today. He's our Chief Medical Officer. So he will probably be the better person to address some of those clinically related questions that you asked. We are continuing to do COVID testing here at the Wellfleet Health Center. Now 3 days a week. We are doing testing on Mondays, Wednesdays, and Fridays in the mornings. And our Provincetown Health Center is doing COVID testing on Tuesdays, Thursdays, and Saturdays in the mid-afternoon. We continue to have patients schedule telemedicine visits with one of our providers prior to being tested. And as I've discussed on other calls here in the past, the most important reason for that is to establish a clinician to determine the appropriateness and the medical necessity of the test and to ensure that there's proper follow-up once the test results have been received, so that the people getting tested are getting adequate clinical guidance regarding the need for self-quarantine or self-isolation, and if they are symptomatic, how to potentially manage those symptoms, how to keep people safe around them. And then when the results are reported, then we're able to connect back with the patient and follow up from there. As many people have heard through the news, the turnaround time for testing results has gotten a little bit longer as the rest of the country, the number of cases have increased, the rate of testing has increased, and put a increased load on the testing services that are used throughout the country. So our turnaround times have, we've certainly seen longer turnaround times for our test results. We remain committed to providing this service to the community, as well as to visitors who may present with medically necessary reasons for getting the COVID testing. And the contact tracing efforts that the health department is doing, we're also working hard to collaborate with those folks who have been identified through the health department and other contact tracers to make sure that they're able to access testing as well. What were some of the other questions that you had, Mr. Chairman?
I was just wondering about, what would you say the average turnaround time is for results on the test right now?
Dr. Jorgensen, do you want to speak to that at all?
Sure. Thank you for having me today. For those of you who don't know me, I'm the Chief Medical Officer of Outer Cape Health Services and also oversee the Wellfleet site as their medical director. So the turnaround time is determined, by Quest, which is the lab that we use to run the tests, has set up a priority system. So for example, if you're over 65 and you have any of the 9 symptoms of COVID, which could include something as simple as just diarrhea, you're given a priority 2, and those usually come back in 3 to 4 days. For people under 65, those are considered priority 3, and those can be as long as 7 days. So it's really unfortunate that the ability, and the interesting thing is, if you're thinking about what are some of the barriers for Quest, it's actually right now it's not having enough people to run the tests or enough machines to run the tests. It's something as simple as having supplies to transfer the sample from the collection tube to the machine. So there's a national shortage of plastic right now, which is used to create the pipette tips, which is used to transfer the samples. And so some of the things that you might think are barriers are actually not, and some of the things that you may have never even thought of are some of the barriers. So for some individuals, it can be as long as 7 days, and for first responders such as rescue squad, they're considered priority 1, and that can be as quick as 36 hours to get the results back. I think there was a question about contacts. So contacts are considered medically necessary testing. So we are doing testing of people who are identified by the Department of Public Health as contacts of positive individuals. It's important to remember that you're considered positive if 3 things are happening. One is that you and the person who, either you or the person who's positive were not wearing a mask appropriately, if you were within 6 feet of each other, and if you were in the same space for 15 minutes or more. So we get a lot of calls about people who maybe were in the same space as a person, but not at the same time, or all of the individuals in the business were all wearing masks, which are not considered actual contacts by the Department of Public Health. If someone wants to get testing, we will offer it in the space of someone being a contact, but the risk of transmission is very low. So for those individuals, they're not officially contacts, so they're not by Department of Public Health, they're not required to be in quarantine, but we'll still test them nonetheless. And I think the final question, if I remember, had to do with the accuracy of the test. The test we're using today is the exact same test we were using the very first test we did on March, I believe it was somewhere around March 10th. So there's been nothing that has changed in terms of having more accurate tests or anything like that.
Is there a rate of false negatives that's associated with the tests?
Yeah, it's still quite high. Nothing has changed about that. So we're using the most accurate test, which is the nasal pharyngeal swab, where some of the patients call it the brain biopsy, but it's where the swab is inserted directly back along the palate through the nose, as far as it needs to go there. But the false negative can be something like 17%. So it's still quite high. And there's also false positives as well, which can be even higher. So some of the positives we've had recently actually were not true new positives. There were people who were sick many months ago and are currently asymptomatic. And those individuals, some people, for some reason, which we still don't understand, remain positive for some time.
Even though they're not, they can't transmit. Is that right?
Well, there's still some uncertainty about that. So the current idea from the CDC, and again, evidence changes every day because we're learning new things every day. The idea is once 10 days have passed, since you are positive and at least 24 hours have passed well, I misspoke there. So once 10 days have passed since the start of symptoms and 24 hours have passed since any fever, you're considered non-contagious. So the thinking is it takes about 4 days to be, for the average person, it takes about 4 days to become positive. And then it takes about 10 days after that, to be contagious, and then 10 days after that to no longer be contagious. So that's where that kind of 2-week quarantine comes from. The idea being that within a 2-week period, the preponderance of individuals will have shown some form of symptoms and should no longer be contagious. Are there people who are passing this asymptomatically? It's likely. The thinking being that these people may be less contagious, but again, it's still unknown. So with a lot of new science, nothing is perfect at this point.
Okay, does anyone else on the board have any questions for Dr. Jorgensen? Is it Jorgensen or Jorgensen?
That's Jorgensen, thank you.
I'm not seeing any hands raised, Mike.
Hands. Okay,
Oh, there's one from the audience.
okay, we have
Yvonne and Mo Barakos.
Mo Barakis. Go ahead, Mo.
Hi, a couple of things. One of the things that concerns me is rumors can be damaging. And, I'm hoping that we get clear information. And this meeting is an important source for that. And one of the things I've heard is that there was an outbreak at a local bar. I don't know if it's true or it's not true, but I hate to rely on rumors. The other question I had was about the walk around the harbor. And I was very gratified when the Board of Selectmen asked the harbor people to put up one-way signs and make that clear. Unfortunately, it never really happened. There was one lame little sign, and if you started at the wrong side, you never knew you were going the wrong way. And on top of that, I think because it's narrow, we should also be insisting on masks on that walk. And a lot of us that do that walk, and I've stopped, frankly, are elderly. So I think that one-way signs and should be increased and enforced, and the board's plan not be sabotaged. Frankly, that's how I view it, and add to that one-way signs. But again, given the rumors.
Mask enforcement.
And mask enforcement there too. Thanks so much.
Okay, Mo. Justina, you got your hand up?
Yes, just quickly for Mr. Jorgensen, correct?
Dr. Jorgensen, thank you.
What?
Dr. Jorgensen, thank you.
Of course, Dr. Jorgensen. Just quickly at the beginning, you answered Chair DeVasto's question about the accuracy of the test, which is the same test since March. I thought you heard 17%. I thought I heard 17% false negative.
It's somewhere around there.
Around there.
This is just what I'm remembering. But there's with all of these, there's like a statistical window for all of these numbers. So it's no better. I mean, it's somewhere between 85, 90, and 90. So it's a
band. It's a range.
It's a range.
Got it. I just wanted to make sure I heard right. Thank you for clarifying that.
Helen, you have a question, comment? Helen.
Please confirm it or not. Is that the accuracy of the test has to do whether or not you have enough of a viral load for the test to register. In other words, if you go in with symptoms, is it true that you would be more likely to get an accurate test reading?
Yes, and also the time since exposure. And so, for example, I'll give you, if you're considered a contact, the recommendation is to test 4 days after your exposure to the individual, because that 4th day is considered the most contagious, the most likely to have the highest, viral load for that individual. So there's many factors that go into determining, the likelihood of the test being positive.
Thank you.
So I just have one more question for you, Dr. Jorgensen. So if someone was in close contact with somebody who had tested positive recently and got a negative test, would you recommend that they still continue to isolate if they had been in close contact?
So if they're an official contact determined by the Department of Public Health, they're going to be asked to stay in quarantine for 14 days.
Okay.
The purpose of the testing of that individual is to determine if there are more contacts to that individual that further, need to be quarantined and tested. So, but we appreciate our close partnership with the Department of Public Health in our various towns we serve, and we've found that to be a very rewarding and productive experience over the last 4 months.
Okay. So I guess that's it for Dr. Jorgensen. We really appreciate all the information, and you might get a few questions coming through as we move on to the next subjects, but I think, so Navigator program would be up next, but I'd actually like to maybe hear from Hillary about the protocol, lags in testing, anything she's seeing that's posing a problem, and a report from our health department, our health agent, about what's been going on.
Sure. Good morning. I think I'm going to start by saying I think Dr. Jorgensen gave a really good overview of what a close contact is. So if we can all remember that when we think about close contacts and contacts, it really is important that we only call people contacts that actually were in contact with the mask on incorrectly or not with a mask for a period of time, 15 minutes or more, because that's how the state looks at it. So with that information, I think that we do have some misinformation swirling out in our community about where there are cases, where there are not cases, how is this place open, but this place is closed. So we did try and put out a little memo to the public. I know it's on the town website. I think it got emailed out to people. It's on some Facebook pages as well. And so from that, what I can tell you is that in our online disease reporting system that's linked to the state and linked to the labs, we have had 2 confirmed cases over the past couple of weeks. That's 2 cases. We have a suspect 3rd case that has not hit the system yet. So what we know is that depending on where folks are tested, there can be a lag in us seeing those results. So we rely heavily on our partners in the community as well to pick up the phone and call us when they have a positive case in their restaurant, in their family, wherever. And so we have been spending a lot of time on the phone, talking to our restaurants, talking to people, trying to find out who's a contact, who's a close contact, and following up with all of those people. And this gets increasingly more difficult without the actual lab results from the state coming through. So all of this has put us in, a rather difficult place in reaching out to people who don't always want to hear from us. But that being said, we did work with Barnstable County and our restaurants in town to reach out to our food service workers to get a number of them signed up for a pop-up testing clinic that's actually going on right now in Harwich. There are over 200 people attending that event. We've had some scheduling difficulties with information going from me to Barnstable County to Cape Cod Healthcare. There are a handful of people who didn't receive calls that still need testing, and we're going to follow up working with Outer Cape Health with those folks. So it's been really, really difficult. We have the VNA working on our contact tracing. And so that is all going on. Now, the protocols that are in place, just so everyone's clear, is that if and when there's a positive case in your establishment, you are to close your establishment and clean clean it thoroughly, disinfect it, sanitize it. And the thought there is that if the restaurant is closed for 24 hours, the virus has time to dissipate in those interior spaces and you have ample time to clean. So some restaurants I know have closed down just out of precaution to clean. Others are closing down to clean because it's their normal day off. So we're in really close contact with all those folks almost daily. So I think those lines of communication are open. We, in addition to that, receive a number of other complaints that we're following up on. Every day we probably get a complaint in. And I think we're doing the best job we can with the staff at hand. If folks need anything, we're here for them. They can call or email or text, whatever is the easiest way to get through to us. The other thing we're working on a regional level is sort of figuring out how we can get one of these stop the spread sites on Cape Cod, because clearly if we have 200 people that have signed up for a pop-up clinic, there is a need on Cape Cod to have more testing available. So we're working on that through Barnstable County and the reopening task force with the state. With that, I'm happy to answer questions if folks have them. And I'm not sure what else I could provide at this moment, but it's, you know, it's very busy.
I'll let Helen ask her question first.
Yeah, and anybody can answer this, but I think it's a Hillary question. Don't laugh, but what is quarantining considered to be these days? Are you allowed to go to the beach?
So that's an interesting question. They have not changed the definition of quarantine. So quarantine means you stay in your house unless you have to go out, as for essential items.
So,
you know, I guess I still encourage people. I mean, people have to go out and take a walk. They need to get some physical exercise. If they can do that safely at a safe distance that's over 6 feet from anybody else, then that is acceptable.
Thank you.
Okay, I just have one question and then I'll go to the audience, hands up. And that is, have you had problems with state reporting, getting to you late, or, and what's the sort of protocol of if someone tests positive? There had been some reports of the information not getting to boards of health.
Yeah, I can jump in, Mike. So there is a delay in that information getting into the state reporting system. It's called Maven. And from what I understand, Carewell in Dennis is not a quick reporter. So I spoke to the VNA this morning and they confirmed that that is still the case. That information is very slow to make it to the Maven system. And then there's another lag depending on where folks are getting tested and where their sample is being sent to. So some labs can turn it around and input the data within 48 to 72 hours, and other times it takes 7 to 10 days. So there is a lag in that information, and that's why in our food service establishments, folks are supposed to call the health department. So people that know that they're positive are supposed to call the health department.
Okay, that's good to know. So, and I have one more from a select board member, Justina, and then I'll go to the audience, I promise.
Hillary, I thought your communication on the website was great. And certainly it's a challenging time for you and your department. And I think we all really appreciate what you guys are doing. I did read that you're sending 134 restaurant workers to the Harwich pop-up. Is that correct?
The numbers is higher than that, but yes, we're sending a lot of people.
And would you say that this comes from just normal events of the day, or are that sort of some of the gatherings of the cause of concern?
So I think I cannot tie it to a specific party gathering or event, although I have been told there were a couple small events and all those people have tested and tested negative. So it's not stemming from a party or an event that I am aware of. But then again, people don't call me and say, hey, I attended this big party with all the folks at, restaurant A, and now I'm worried. So I don't get calls like that. So that being said, what I think, I reached out to all of our food service establishments. They all have a number of employees. And while I think some of these folks are not close contacts as described by the doctor, they are contacts and they are nervous, and their restaurant owners are scared and frightened. So I think
one phrase I found really encouraging that you said, which is you're in close contact, and you and the owners, I assume, and managers of these establishments. It sounds like you're all working together, and then there's the pop-up. So to me, that all sounded very encouraging.
it's encouraging, except I'm losing my family and gaining a new family. I've got a lot of new husbands that I never knew I had.
Are you in trouble at home?
And wives, so.
And probably some teenage children that you didn't know you had.
It's
Again,
interesting times for sure.
Well, a big shout out to you and to all involved. I thought the communication on the website was forthcoming, and thank you very much.
Thank you.
Okay. Casey Myers, you have a question?
Thank you very much. It's for Hillary. Oh, hold on a second. I have to unmute.
Good. You're good.
Okay, thanks. Hillary, does Wellfleet have a policy where they announce publicly the names of restaurants of a positive case?
We don't have a policy, and as of this moment, we don't have a confirmed case in our restaurant. So, be it what it may.
So if you did have a positive case, would you announce it or not?
I don't have that answer today. I'm sorry, but I would rely on our restaurants to be forthcoming with that information.
Okay, great.
Okay, Denise Quealy.
Hi, thank you so much. And I agree, the communication's been wonderful. I just had a question about the testing. If someone were tested positive, where does that get reported back to? Is it the person's residence within Massachusetts? Like, how do you know? I'm assuming the two people that tested positive were Wellfleet residents. Are you also getting notices about, other positive tests? And the other question I have really quick, or a comment, is that if you could update the website in terms of the travel advisory and the travel information, I think it would be helpful. Right now, it's still saying if you travel from China or whatever, you have to 2-week quarantine. But I think maybe putting the governor's advisory up there.
It's on the website, Denise, in probably 2 different places.
Oh, okay. I didn't see it when I went to the cover page. So thank you so much. And Michael, just to let you know, I would never take matters into my own hands with a person with a different plate. I just wanted to comment on that. And the cars that I saw actually were full of luggage. So that's the reason I brought it up.
I just wanted to put the reminder out there. But
Absolutely. And I agree with the Facebook. I agree with everything. I'm just so, I'm psyched that you guys are so wonderful at communicating. So thank you.
Can I talk to the testing for 1 second, Mike, please?
Yes, please.
So the testing that gets done, we do ask for your mailing address. And while we do our contact tracing and follow-up, we find out where the person has been, where they live, and who they've been in contact with. So while the case might not get reported to Wellfleet, if there is a close contact in Wellfleet, then we follow up that way. So all of our Wellfleet cases have Wellfleet mailing addresses. And of the, folks that we're sending to the testing clinic today, most of those addresses are Wellfleet. There's a handful that aren't, but all of those cases are going to be tagged as Wellfleet. So we'll find out their status. So the VNA is aware of who these people are, and everyone on the list submitted to Cape Cod Healthcare will be tagged as Wellfleet. So we will find out the status of all of these folks.
On that same subject, Hillary, if someone were to randomly test positive, say at Outer Cape Health, that was maybe from, Connecticut or another state, that would, I imagine, get reported back to that state, and then contact tracing would initiate from that state
Yes, correct. So
back to Massachusetts, then back to the health department? I imagine there's some type
Yes.
of lag there as well.
yeah, so it all depends on, again, how quickly the results get logged into the system. But the disease contact tracing starts, within 24 hours. So we would have that information in theory pretty promptly.
As long as everything got to them.
Exactly. Got from the lab to the reporting systems. But as far as state to state communication, those lines are open.
Okay. I'm just going to move on to the Navigator program update right now. I don't want to keep Brianne Smith on the line for too long because I know she's really busy too. Bria, you there?
Yes, hi.
Hi.
Sorry, you're going to get me masked for a little bit. So I am with the Community Resource Navigator program. And for anybody that's not familiar with that, that's actually a free service that's provided to all Wellfleet residents, not just patients of Otter Cape Health. Myself and Paula Erickson are actually the navigators that work in the town. And really what our job is to help residents connect with all the good work that everybody is doing out there and everything that's available to help support them. So we're still open for referrals. I can certainly let people know how to make a referral if they want, but just as far as what we've been seeing and who we're working with, certainly working with the Common Table, that's something out there that's helping provide food. Food security is something that's certainly on the top of the list for everybody, whether they have limited income or they're just reluctant to go out and get their groceries. Same thing with medications. There is a fund that is being started in Wellfleet for such emergency purposes, which has been great to see that pop up. How we've worked closely with How, they actually had a program that they did where they had 30 tablets that they were able to provide to their clients in all of the towns to really help with the social isolation piece. There's a lot of programming and things that are available right now electronically, but for some people that either don't have a device or they don't have the best internet connection or they don't have the technical skills to use that, that can be a little difficult. So that's been a really great program to help people stay connected. Certainly behavioral health and substance use services are continue to be a need. We're seeing an uptick on that end for us. I think part of that is, again, the lack of connection. A lot of what we do, we normally do home visits, and that really helps kind of move people in the right direction. And sometimes just talking over the phone can be difficult for people. To that end, we are doing everything by phone right now, except in some cases we do have the capacity to do outdoor, socially distanced, masked visits. All the kind of stuff that goes on with everybody's normal lives didn't stop doing this. So people are still getting paperwork in the mail about mass health renewals or SNAP renewals or housing paperwork. So there's still a lot of information that's coming into residents that a lot of people can use another set of eyes looking at, helping fill it out. So we do have some ability to help people in that way, but for the most part, we're doing everything by phone right now. So really important in that has been keeping in communication with Cape Cod Hospital, keeping in communication with Gosnold, keeping in communication with all the service providers so that we're able to link people in as quickly as possible and really try and meet the needs, whether it's transportation, food access. Financial need is huge right now, but again, there's a lot of things out there. It's just helping people know what it is and how to access it. So we're here, we're available. I can certainly send information to the group if they want to know how to make a referral, but I don't know if there's any questions.
Does anybody have any questions for Bree about the Navigator program? I have one for you. As far as like backup contact tracing, if our health department gets overwhelmed, if we do have a situation where there's a lot of contact tracing that needs to happen, you guys provide, or you do through a separate program, Bree, backup contact tracing. Is that correct?
So Hillary may be able to speak to this more, but essentially Partners in Health is the backup to all the local boards of health. And that's something that they've instituted in this area. But again, it goes to the local boards of health first. And what I kind of say to that end is that you know, that the community resource navigator is essentially the same as what the contact tracers are asking, I guess, is sometimes the same things that we're asking people normally. You know, how are you getting your food? How are you getting your medications? You know, how are you managing your stress? So sometimes there's people in the community that are not necessarily being contact traced, but need some help because they're choosing to stay home, or maybe they do have some needs because some of the traditional services have broken down. So we're available to all residents of the towns, and we take referrals from anywhere. So certainly if there ever is a need, you know, Chief Hurley, the police will call sometimes. Certainly if Hillary had something, the school has something, we get referrals from all different sources, and it may not be as structured as a contact tracing necessarily, but if there are additional needs that people have in the community to kind of weather this storm, we're available for that for everyone.
Okay, and can you share the best way to contact the Navigator program?
Sure, they can. So if you go on Outer Cape Health's website, it is listed under community-based services, but they can also call my cell phone, which is 508-237-0132. Again, Paula, I'm a social worker. Paula Erickson is a community health worker. We work together in the town. So you'll get a call back from one of us within a day.
Okay, thanks a lot, Bree. Helen, you have a question?
Yes, through you to Courtney or whoever, is this on our website? Is this in the COVID section?
It's in two places. It's under the COVID-19 resources and under community resources, where it's been for the past 2 or 3 years.
Thank you.
Okay.
We do have written material, not that we're encouraging necessarily written material right now.
Okay, well,
Mike,
thank you.
can I jump in for 1 second too, please?
Go ahead, Hillary, please.
Just on the contact tracing. So we have the VNA as our primary contact tracers. They work Monday to Friday. On Saturday and Sunday, if cases pop in, then we go through the testing collaborative, and we're in close contact with that person as well. So at this moment, we're not overwhelmed following this clinic. I don't think we'll become overwhelmed because the community partnership has a number of folks on there that work and then transmit information back to the VNA, and the VNA has a large staff as well. So I think we're good on that front.
Okay, that's great to hear. Thank you, Bree. And I don't see anybody's hand up. So now we can move right on to restaurant compliance. And there's been some reporting of non-compliance to COVID restrictions as far as restaurants. And I don't know if the Board of Health has experienced that. And if they, you know, if you'd like to speak on anything, Hillary.
Sure. So there's always non-compliance, right? In everything we do, there's always non-compliance. So to gain compliance, we rely on communication. Once again, we do site inspections, we follow up. We are also required to follow up on each and every complaint that comes in. So we do all of that. And, you know, generally we can gain compliance just by talking and looking and pointing out what's incorrect. Most, if not all of our business owners want to be compliant. There's a lot on the line for them as there is for us. So, you know, it can be something as simple as your table slid, you know, a foot to the left, and now it's only 5 feet instead of 6 feet from the table next to you. So, you know, we see a lot of that. We do have an outstanding issue in town. We're working on it. We hope to have resolution to it shortly. And I would just ask the community to continue to reach out to us with your complaints. It helps gives us more eyes and ears as to what's going on, because we can't be everywhere at the same time. So please feel free to contact us with any complaints or any concerns you have.
Okay, thank you. Does anyone from the board have anything? Christina? Go ahead, she's muted.
Hi, quickly, is there anything, it sounds like you have it well in hand, good communication. I thoroughly enjoyed your report, but were we to go down the line with this, is there anything the select board can do to support yours efforts as the licensing authority for the restaurants to support the general efforts of public safety in the town?
So I think at this time, I just need a little more time to work on a few things. And when I am ready, I will get back in touch with you with anything I may need your help on.
Well, it sounds like you know that we're here for you.
Yes, absolutely. Thank you.
Thank you. Thank you, Hillary.
Helen?
Yes, ditto on what Justina said, but Hillary, I'm a little concerned about something, and you are the one that is the most aware of the delicacy and the exigencies of the situation with the restaurants and places that have constant food service interaction with the public. But to get back to something Casey Myers asked earlier, why is it if a restaurant is out of compliance, if they're not then shut down until they get into compliance? I feel that it's kind of risky and perhaps not the best publicity for Wellfleet to have places that aren't strictly in compliance able to keep serving. I find that kind of scary. Can you comment on that?
Yeah.
It sounds very difficult.
I don't disagree with you, but in order to follow the governor's requirements for enforcement, there are steps that need to be taken. So we've been in contact with an establishment a number of times. I reached out to them again, most directly last Wednesday. I read them the Riot Act. I told them everything I expected them to be doing and how to do it properly. We followed up again, and I told the restaurant I would be back in touch this week on Wednesday. So I wanted to give it a week to see if they could come into compliance, and tomorrow is that day. So in the interest of consistency and follow through, I think I'd like to have that conversation with the business owner tomorrow before I take any further action.
So I would just like
Thank
to
you.
quickly remind any restaurant or business owner that the Board of Health has broad latitude to enforce these regulations. And the Select Board is the licensing authority for both liquor licenses and business licenses. So I would urge any restaurant to come into compliance quickly with our health agent. And this is a public health emergency that we're in right now. We may be in a situation where there's a couple isolated cases, or we could be in a situation where we're just seeing the tip of the iceberg. And close congregation, indoor spaces are highly risky. If you're not complying with what the state has laid out for you as a business to be open in this current public health crisis, there will be action to some extent. And whether it's a license hearing or just as simple as the Board of Health taking the adequate measures that are necessary for public health, I'm fully in support of that, because this is a once in 100-year pandemic, 150,000 deaths in the United States. You see what's going on in places like Florida, Arizona, and Texas. It can happen quickly, beneath the surface, asymptomatic spreading. There's a high rate of mobility on Cape Cod right now. There's people coming from all over. I don't expect everyone to be complying with the 14-day quarantine order. And, we don't want this place to become a hotspot. And so compliance is extremely important. So I will just put my weight personally behind Hillary in whatever she needs to do to get businesses into compliance, in whatever respect. So,
And again, yeah, I think I'd just like to add, we're not asking people to go above the minimum standards either. So we are holding the line at the minimum standards. We don't have anything in addition to that. And what we have, it needs to be followed. So it's really important, especially right now, that we all follow the rules and regulations in place.
Okay, and we've also currently seen some towns around us change their liquor license hours and things like that. So these are not just problems isolated to Wellfleet. They're definitely around the Cape. I would just suggest that everybody proceed cautiously, remain vigilant, and adhere to the guidelines set forth by the state. Justina?
I agree with Michael. Very well put. Thank you, Hillary. And I would add to our valued guests from states that are under the travel advisory, please exercise personal responsibility.
Okay. And Jude Ahern. Keep it brief, please, Jude.
Thank you, Chair. I just want to say a couple of things. People who have visited Wellfleet, friends of mine over the years, are all so happy about the time they spent this summer. They said that they felt safe and the weather. And so the word on the street is that people are very happy, which is great. But I think a week asking for compliance is too long, especially when we have these delays in testing. So that is something we can control, as you say, and I think we should. I think a week is too long, especially when we're asking many of our visitors now to quarantine for 2 weeks, yet the people working in the restaurants, now we've learned about what a contact is and what is not. So this is something we can control, and I think we should.
Okay, thank you, Jude. Okay, does anybody have anything else? Helen, Miranda, Wilson? Go ahead, Helen.
So we don't know which out of compliance restaurant has had these problems. And my personal response to that, which I hate because I want to keep businesses going here, is I'm not going to go to any restaurant in town at all. I don't know which restaurant it is. And I would hope that the minute there's lack of compliance, that until a place is sanitized, until a place goes through the rigmarole of making themselves safe, that they not be allowed to be open. And the Board of Health, the health agent, I think, would have the ability to do that. I'm not sure about that. That said, cooking in a restaurant kitchen with a mask on in summer is hell. I get it, but that's what it is. And this is a horrible situation. Nobody's happy about it, but we have got to be more clear, in my opinion. I mean, waiting for a hearing, a licensing board hearing, that's too long if a restaurant continues to function while that's happening. Thank you.
Okay. So are we ready to move on to the next topic? I feel like that's been gone through. I don't see anything else from anyone. We have beaches and beach parking on here, and I can't remember why this is on here, what we were.
So basically, this is mostly just because it's been wanting to be discussed, but next Tuesday at your regular select board meeting at 7 p.m., Suzanne Thomas will come prepared with the information requested by select board member Curley about the extension of the beach sticker parking through September. So this was just kind of in case there was any other updates, it could go here, but next Tuesday is when you'll hear information from Suzanne about Mr. Curley's recommendation to extend the beach sticker season.
Okay. I also would like to just add that I think the point brought up in the beginning by one of our audience members to add compliance to the 14-day quarantine restriction to our beach sticker process, so that we have people who are able to show what's complying. So who's in compliance, whether they can get a beach sticker or not. Obviously, we can't go around with the police and ask them to enforce everybody with out-of-state plates. You know what that leads to and what it looks like. But I think if this could help in any way get people to at least get the test or show that they're negative or that they're in compliance with the state in order to get a town beach sticker. That could go a long way. Ryan, you have a comment?
Yes, I would like to again encourage mandatory mask wearing within the Oceanside Beach parking lots. The problem there is not necessarily, I know there's the 6 foot separation and then you're supposed to wear a mask. It's kind of a muddled message because when somebody enters a beach, it can be different conditions than when they leave the beach or when they go and use the facilities. You know, if somebody arrives at the beach at 9 or 8 and it's fairly sparsely populated, they obviously do not need a mask to get down to the beach. But if they're trying to get up the dune and into the parking lot at noon, let's say, you know, that's a much more crowded situation. So I would, you know, again, recommend requiring masks within the Oceanside Beach parking lots.
Okay. Kristen, Shantz?
I'm mute. Sorry. First, I'm going to apologize and ask everyone's indulgence because I didn't see the raise your hand part, and I've been waving my hand to speak. So very quickly, I have a comment, a clarification, a question, and a request. My comment is that I support those voices that have jumped on and said that a week is too long to tolerate non-compliance in an establishment. My clarification is to Hillary that when we or someone in the public hears of cases, you want us to text or call your office. My question is that, so people who were tested last week at the site in Dennis, given the rate of false negatives, who's following up with that? And my request is that probably after Labor Day to look at food insecurity in our community, especially given that no one really knows what's going to happen coming into the fall and the winter. When I think of 246, the mustard seed, the COA, common table, I mean, et cetera, I think it would be great to do some planning. Thank you.
I'll speak to the last thing that you just said, Kristen, and that is that I think that there will probably be the needs committee meetings starting again, and all those organizations are part of that group of people who meet. And if you'd like to be involved with that too, just send me an email. And then the other questions I think were mostly directed at Hillary.
So for the folks, there was a question, Kristen, that you had asked and you had sent an email and you were breaking up. So I couldn't quite hear your question. Can you go ahead and ask that again, please, about the folks that were tested in Dennis?
Yes. What is the follow-up for folks that were tested, had the rapid test through Dennis? What's the follow-up regarding false negatives or the question? Let me just back up. The folks who went to Dennis were not given any kind of paperwork or advice as to how to proceed, either with contacting their primary care provider or contacting a local board of health. So how does that get handled? Thank you.
So my guess is that many of those people do not actually meet the mark of a close contact, as you heard from the doctor earlier on this call. So that being said, most of the folks in the restaurant industry that went for the testing, I have spoken with the manager or owner of the business, and we discussed a number of those people, what their contact was, what their contact wasn't, what their length of time with the contact was and wasn't, and under what situation and circumstance. Now, that being said, everyone that left Carewell should have left with some information on the test that they received. So A number of those people that went to Carewell are being tested today. Some of them, most of them have been out of work for a number of days, just waiting to see if any symptoms pop up. So I think we have a decent handle on that. And we'll just have to see as we go forward. But again, you know, the gold standard is the PCR test, which we would encourage people to call their doctor first. That has never changed and isn't different from any information that we put out, you know, months ago. Your first step should be with your doctor so you can have those appropriate discussions. So what people do and choose to do, you know, it's a personal choice. If someone is so concerned they want to go to dentist and get that quick rapid test, they can do that. They should understand what the accuracy rate is and is not, and have those discussions with their employer as well. So, I mean, we're open to talk about it, and we need to understand the full situation and not just what the test result is.
Okay, so moving on, we have other recommendations and updates. Do I have any? I see Justina's hand went up first. Then Ryan, and I might have missed someone in the audience there for something else, but let's hear from Justina.
Sorry, Courtney, I've had myself on mute because someone's banging on a wall in my house. I would like to invite the business community, perhaps out of the Chamber of Commerce. I'm happy to reach out on how the business community intends to handle the travel advisory, because so many of these people from the states that Governor Baker put under travel advisory come and stay in short-term rentals and hotels. And I think it would be interesting to hear the processes and procedures being followed. So that's my concern about that advisory. I think some more information would be good.
Okay, Ryan.
Okay.
So Michael, do you feel that goes under future concerns?
Yeah, I would put that under future concerns. Can you clarify it for me for really quickly? You want to have the business community? I mean,
I'd like to hear from the business community what we're going to do about the travel advisory, and I'm offering to follow up on that.
do you want to do that through the, you'll follow up on that?
I'll contact the Chamber of Commerce because they sent out an advisory on that.
Okay, that sounds good. Okay, Ryan Curley.
All right, Mr. Chair, through you to Chief Hurley. So we have this storm coming up. It's the local impacts are probably not going to be significant, but it did bring to mind that we are just now entering into hurricane season. And so I was wondering how shelters might be addressed in the time of COVID so that we know what that information is. You know, obviously we hope that we will not need to use shelters this year. And a lot of years we don't need to, but it is a concern with this season that we're now entering. Thank you.
Thanks, Ryan, for the question. Actually, last month, we did a walkthrough at Nauset High, which is our regional shelter. Right now, the Barnstable County Emergency Planning Committee is re-examining all of our shelters for all types of reasons. One is going to be separation, preparing for the need for additional transportation vehicles if we need to move people to shelters, screening, sanitation, general public health protocols. So in the past, we may have used a gymnasium or 1 or 2 rooms to house people. Now we're looking at the footprint of the whole school itself to see how we can separate families and people coming into the shelters. I know the state is also looking at, depending on the degree of a weather event and the need of sheltering, to block off hotel rooms for that segment of the population that is more vulnerable to COVID. So it is in motion. Of course, this storm is a little earlier than usual, but we are re-examining the shelters and making them COVID compliant.
All right, thank you.
Helen?
I would like to do more than have this as a future concern. I would like to ask the select board, let's have our next meeting have a quick report from somebody from the Chamber of Commerce. It doesn't have to take more than 5 or 7 minutes. And this is a select board meeting, among other things. And I'd like to move, addressing the select board, that we delegate Justina to contact them. Do I have a second?
Second.
Thank you.
Okay, all in favor?
Helen, I.
Justina, aye.
Yep, Janet, aye. Everybody did.
I think that's, I didn't hear Ryan, but I think.
Ryan, aye.
Or Justina, this gives you more authority, right? And
Thank you, Helen. You're our elder statesman.
yeah, right.
Maybe the elder was tactless.
Yeah.
but-
So here, no, that's fine. Here's the thing. This is part of something we had at a previous select board meeting where one of us at least said, this is the news, the breaking news is all the time, and we need continuous updates. And this could be one of them. Thank you.
Okay, I have one question from the audience, Susan Spear.
Hi, am I unmuted?
You are.
Okay, I just wanted to remind everybody and tell people who don't know that a group of 5 of us local health professionals has gotten together and created something called the Well Line. It is well publicized on the town website as well as on several Facebook pages. And we are there as a listening line, as a buddy system, and as a weekly Zoom drop-in support group to help people with whatever they need. We're not going to provide direct services other than that, but we can refer people to whatever services they are in need of. We've been working closely with Mike Hurley, and we are happy that this is now up and running. If it would be helpful, I can give out the phone number now, but it might be better just to send people to the town website. It's right under news, and they can also find us as the Wellfleet Well Line on Facebook.
Why don't you give the phone number? This will be on television, so.
Okay. The phone number is 508-514-1633. Someone will answer or get right back to you Monday through Friday from 9 till 5. And any other time you call and leave a message, we will get back to you the following business day or sooner. You can also text and or leave a voicemail, and you will definitely hear from one of us.
Okay, thank you. All right, one more. I got 2 more from the audience, and please make them brief. I just want to get our department and staff back to their busy days. So Jennifer Wortkin from the library.
Hi, I just wanted to give a brief update where curbside delivery is going, or pickup is going really, really well. We've given away thousands of items to all of you, and the community really seems to enjoy it. So, so that's going well. One of the things I wanted to mention that was brought up during the Navigator program was that about connectivity is we're circulating hotspots, and I don't think we've gotten the word out about that well enough. So please spread the word that we have Verizon hotspots for people that need them. And, we have them to circulate, and let us know. So, so that's sort of the main announcement that I have. The other one is that we are doing some really good programming, and we are getting a lot of it processed to get up on our YouTube site. So that's where we're at.
Okay, thank you, Jennifer. And Mary Ellen Manning. She's muted. Okay.
Oh, hi, can you hear me?
Yep.
Hi, I hope everybody's doing well. I was hoping to get some sort of a sign on Coles Neck Road as you come up towards Herring River Road that says slow blind corner or something, because a couple of days ago, I was pulling out of Herring River Road to take a left on Coles Neck, And I'm glad my husband was with me. There was a car that came out like a shot, and George grabbed me and I slammed the brakes on. If not, I would have been killed or badly hurt. It's a very blind corner, and it's been dangerous for years, but what happened the other day really frightened me. And I think that we need some sort of sign there for the public safety. Mo's on the line. I wonder if he agrees. I don't know who I would ask. I actually called and left a message for Mike Hurley, and the dispatcher said to call the town hall, but I just, since you guys are having a meeting, I thought I would ask if the select board could have the DPW install some sort of a sign at that corner, as you're coming up towards the dump, right before Herring River Road. I mean, the person was going really fast.
That is a difficult turn. Sorry, I've had the same issues. The difference when you're pulling out at night, you can see lights coming towards you. During the day, that is a very dangerous turn.
Okay.
Thank you, Mary Ellen.
No there's recommendations and updates, so I appreciate that. We're not going to have a protracted conversation about it, but I think the DPW would be the correct department to involve in that, at least to do the preliminary look at it, right? Is that correct, Chief? Yeah.
Thank you, Mr. Chair. Mary Ellen, if you could send an email request to me, and I will work on that with Public Works.
Okay, great. Thank you very much.
Okay, and I would also like to welcome our new town administrator, Maria Broadbent, who's been on the line, and I don't know if she'd like to speak about how her first week's going and anything she'd like to say to the town. And we welcome her and are happy to have her here. Maria?
Thank you, Mr. Chairman. Nothing to add, really. I know I've been getting up to speed and talking to staff individually about what they're working on related to all the topics on your agenda. And, I know Hillary and I will have a conversation after this meeting about some of the enforcement actions, but, happy to be here. I'm glad that the storm has turned out not to be as big of a deal as we thought it was going to be a few days ago. So thank you. Looking forward to working with all of you.
Okay, thanks, Maria, and welcome.
Welcome.
Thank you.
Okay, and topics for future discussion. And I would say anyone who is on this meeting that is town staff that does not have topics for future discussion for us to bring up is welcome to drop off of this phone call, because I know you guys have busy schedules. We're in the middle of summer. So thank you all for being here. And I'll just go to the board. Any topics for future discussion?
The usual.
The usual?
Yeah.
What is that? You got to remind me what the usual.
Well, an update from every department, just like we did today.
That would be on the third. So the third Tuesdays of the month at 10 a.m. are community update calls by the emergency management team staff. That was decided about a month ago. This meeting was called mostly because there was a lot of issues arising with COVID. You wanted to meet now. So next Tuesday, the 18th at 10 a.m. will be the regular community update call.
Okay, and that'll be chaired by one of our
either Chief Paul or Chief Hurley. Yep.
Okay. Anything for our next select board meeting, which is on the is it on the 11th, Courtney?
Yes, next Tuesday at 7 p.m.
Hi, Mike.
Yeah, I'll email you.
Okay, go ahead and email if you think of something. Helen?
Yeah, I will also email you and Courtney and Maria. There's something that came into my email inbox that is very serious, and I have to get the ducks in a row before I bring it up. But it needs probably immediate attention, and it's very concerning. Sorry to be secretive and melodramatic at the same time, but you'll hear about this very soon. Thank you.
Okay, well, I'm intrigued. Okay.
Yeah.
And I don't have anything at the moment other than what's on there. I'll have to think about it if there's anything that needs immediate attention. And I guess that's it. I don't see any other hands up. So would anyone like to make a motion to adjourn?
I so move. Helen.
Janet,
We need a second.
I just seconded.
Thank you. Helen, I.
Janet, I.
Justina, I.
Brian, I.
Michael, aye. Okay, this meeting is adjourned. Thank you all. Thank you, town staff. Thank you for all you guys are doing. It's hard work right now, and I know especially for our health department, who has taken on their normal activities and the new COVID activity. Good luck, Hillary. Basically. Okay, thank you.
Okay, bye-bye.